So welcome tonight. We're going to do our talk on inflammation and gut health. So what do we look at when someone comes in with GI issues? One of the first things we look at are x-rays. So we do comprehensive x-rays on every patient that wants to have them who comes in. So we do lumbar, thoracic, and cervical x-rays, and we're looking at the spinal structure from a chiropractic standpoint, looking for, disc degeneration, sciaticas, hip rotations, things like that. But we also look at things like bowel patterns. So for a thoracic or lumbar x-ray, when we see somebody's x-ray, we would like to see it looking like something like this. Okay? The abdominal cavity, pretty clear. Most of this should have this kind of like light gray. Now, we don't see that on this person's x-rays. We see lots of bowel gas, possibly feces, backed up feces. Maybe there's infection, inflammation. But this was someone who came in and then after having food allergy testing, comprehensive GI testing, later on down the line, after a few months, this is what their gut looked like, and they were feeling much, much better. But this is what we love to see when someone walks in. This is usually what we see. And we see it in various patterns. So we'll see, massive amounts of stool and stuff that pushes out on the belly. So a lot of people come in with this distended belly, and they say, I can't lose this. And then when you look at them, you see all this stuff. You can actually see the outline of this person's colon. Colon is soft tissue. You should not be able to see that on x-ray unless there's severe inflammation inside. Hi, Lori. Take a seat. So when you can see the ascending transverse and descending colon, you know this person is full of crap. Okay? And it might be you, it might be your spouse, but there's a lot of people walking around with a lot of inflammatory processes going on in their digestive system. Some people are aware of it, some people aren't. So one more example, this was a lady in her 70s who couldn't leave her house in the afternoon because she was having uncontrollable diarrhea. And through stool, that GI function test, it's a comprehensive GI test, and then looking at what foods she had, she was able to get her digestive system under control. So within a couple months, she was having regular bowel movements, not where she was having to wear Depends to be able to get out in the afternoon. So she had a bunch of infections and things like that. So when we see this kind of stuff, we look at things like gut infections. And for what we actually see in the GI system, we might see abdominal bloating, excessive gas, abdominal pain or discomfort, diarrhea, constipation, nausea, malnutrition. Pretty common things that people complain about all the time. Heartburn, reflux, burping, belching, bloating. They feel terrible if they eat breakfast. That's all just usually in the stomach. Then on down the line, people have tons of gallbladder issues. So there's lots and lots of areas of the GI system that can have problems. Now, there's also non-GI symptoms. You can also have skin rashes, itchiness on the skin, depression, anxiety. Mental health issues often start with the gut because most of the neurotransmitters, our brain health, our serotonin, norepinephrines, a lot of the things that we use for depression and anxiety, like SSRI medications, serotonin, select serotonin reuptake inhibitors. That's mostly made in your gut. So serotonin is made about 80 to 90% in your digestive system. So if you don't have a healthy digestive system, you're not going to have a healthy brain in a lot of cases. They talk about the gut-brain connection. So what happens down here affects everywhere in the body, But that's why depression and anxiety is on that list. Fatigue, inability to focus, unintentional weight loss. So some people are having, 30 bowel movements a day. They can't control that problem. They've got, Crohn's or ulcerative colitis, things like that, where everything they eat just runs through them. You might have autoimmune problems, high blood pressure, tooth decay or loss, or basically everything else. So you can have so many different symptoms, and they can come from the gut, and you may or may not know it. So what do we break down these infections to? Bacteria, fungus, parasites, and virus. And fungus usually includes some sort of yeast. So how do you test for those things? That's where we look at that comprehensive GI function test. So what is that? That is a stool test. It's a 3-day stool test. This is not something that you have at the hospital. When someone says, oh, I had a stool test done, that usually means they were looking for some sort of parasite or something like that when you went to Thailand or, and were drinking the water and then you had diarrhea for 2 weeks and you're trying to come back and they're looking for something like that. They're not looking at the overall function of the body. They're not looking at how your fats are processed, your carbs are processed, your proteins are processed. Where are those inflammation levels? How is your gut microbiome doing? What does that mean? That means all those probiotics that are in your large intestine. How are those colonies doing? It's kind of like a population down there. You want a good balance of the good stuff and a good balance of the not so good stuff. You don't want an overgrowth of the ones that can turn into infectious bacteria. So one of the ways of checking for bacterial infections is when we do this gastrointestinal microbiome culture. And this looks at the beneficial probiotics. You want those to be all +4s, so that green bar all the way across. So this person's lacking their lactobacillus. Then they'll test for some of the additional bacteria that they find in there. So 1 through 3 in the green usually means not too much of a problem, but when we hit into these yellows, those are potentially pathogenic. So this person has potentially between 2 and 4 different bacteria that could be the start of a bacterial overgrowth or infection. They'll also test yeast. So small intestine, if you have a lot of bacteria in there, they'll call that SIBO, small intestinal bacteria overgrowth. We shouldn't have much bacteria in our small intestine because the bacteria should be killed by the acid bath that is the stomach when it's coming down this way. Now, occasionally it can leak up through the large intestine too, and that's where you could talk about leaky gut kind of things. So, and bacteria overgrowth of something called H. pylori. A lot of people have heard of that. They'll say, oh, I had that tested. H. pylori is a normal bacteria for the stomach. But if you don't have enough stomach acid, H. pylori will tend to create an overgrowth, and then it can start to damage the lining of the mucus lining of the stomach and create problems that way. And then you can have an overgrowth. So you need to have enough stomach acid. A lot of people are on acid reducing or stopping medications for their stomach. So it's one of the most prescribed medications in the country. So the large intestine, so the majority of the gut microbiome is found there, and red typically is an indication of pathogenic. Yellow is an indication that it could become pathogenic if there's too much of it. So this is one of the ways that we check for how we're doing with some of the bacteria. So what are some of the causes for bacterial infections? Decreased stomach acid. You're going to see that over and over and over again during this talk. So if you don't have enough stomach acid, then you don't have that acid bath to sterilize your food, sterilize what you're putting down your throat, all those things can have parasites, bacteria, yeast on your food. I mean, think how many recalls Hannaford's Market Basket has on foods all the time. That's why we have stomach acid. It's to kill that stuff when we eat it, so that it doesn't get into our gut and create infection or overgrowth. So antibiotic use can also create bacteria infections, because antibiotics, kill everything, good, bad, indifferent. It's like a machine gun, just blasts everything in sight. So chronic stress can do it. Poor diet, so excess refined sugar. This is the perfect time of year. So we got Halloween, Thanksgiving, Christmas, and New Year's coming up. So processed foods, lack of fiber. So those are all different reasons why you could have more propensity to have a bacteria infection. So why am I showing you a picture of somebody's hands? Well, this guy's name is Mark. If you look over on the left side, you see hands that are swollen. You can see that there's infection on his hands. He's got severe eczema, and he tried all sorts of creams, all sorts of meds to try and help with it on the surface. But skin problems are often a window into the gut. So it ended up that the only thing that he was able to find that helped was to do a GI function test, and they found 4 or 5 different bacteria infections. So getting that under control took care of the infection on his hands. And he didn't need any of the creams, medications, anti-inflammatories that he had to have. And you can see that the reduction in the size, they look like little sausages. There's a lot of inflammation there. So in his case, that was what helped him the most, was figuring out that he had something happening in the gut. So for the small intestines, the most common bacterial overgrowth is, again, it's called SIBO. It's a small intestine bacterial overgrowth. Again, decreased stomach acid, decreased gut motility, meaning that the stuff stays there for a long time. It doesn't move through. Medications that can affect that are antibiotics. PPIs, or proton pump inhibitors, those are stomach acid reducing medications. And different narcotics slow down the movement through the gut. So what are some symptoms there? Abdominal bloating and distension, discomfort and cramps, excessive gas leading to belching or flatulence, changes in bowel movement, so constipation, diarrhea, or both, acid reflux, and nausea. So a healthy gut should have some amount, but if there's an overgrowth, that's where you'll end up with a SIBO infection. Again, what are some of the non-digestive symptoms? Because we see this a lot. Brain fog, fatigue, headaches, weight loss or weight gain, joint pain, mood symptoms, deficiencies in iron and B12, skin problems like eczema and rashes, just like that guy had with his hands. So, anyone have any joint pain in the room? Yeah, and who's been to the chiropractor and it's not resolved? Who goes and has headaches and they get adjusted and it doesn't take care of it? There's more than one reason why people have these issues. So, people tend to think chiropractors only adjust the spine, adjust the spine, adjust the spine. But you can do so much more. So these are some different things that can come about. Another part of the gut, the stomach. And I would argue if you don't have a good stomach functioning, the rest of the system is not set up to win. You need to have normal flora. You need to have the proper amount of stomach acid. And if you don't, it's going to lead to weakening of the mucus barrier of the stomach. It'll produce toxins that will damage the stomach lining. And that's where people start talking about things like Barrett's esophagitis, where they get the erosion of the mucus lining and it's like a precancerous condition in the esophagus. It's that stomach acid coming up because either H. pylori is overgrowing and taking out the mucus lining, so then acid is actually hitting the lining and creating irritation. So we've got to make sure that is working properly. So H. pylori colonizes the stomach lining by producing an enzyme called urease, which neutralizes the stomach acid and allows the bacteria to survive in an acidic environment. But the presence of H. pylori can trigger an immune response that can lead to inflammation of the stomach lining, or what's called gastritis. This inflammation can weaken the protective mucus barrier that shields the stomach and duodenum from stomach acid. So again, it's all about balance. So we are meant to have bacteria in our bodies. We don't need to be afraid of bacteria. It's just keeping it in the right amount of balance. So damage to the lining, as the protective lining is compromised, stomach acid penetrates and damages the underlying tissue, leading to sores or ulcers. And then the H. pylori can also produce toxins that can further damage the stomach lining and contribute to ulcer formation. So H. pylori is a normal flora. So should be there, but not overgrowing. Decreased stomach acid is caused by mental stress, not enough protein intake, and excessive sugar consumption, and different medications. So Tums, Prilosec, Pepcid, Tagamet, all of those over-the-counter meds, or the prescription meds that so many people are on, and there's no answer. They're not supposed to be on that for more than like 3 to 6 months. But I have patients that have been on that for 20 to 30 years because they've never had anything addressed to try and figure out why. Why is my stomach having all this trouble? Why do I keep having heartburn? So maybe there's food allergies. Maybe there's stomach inflammation there. Maybe there's bacterial overgrowth. Those things need to be tested. And sticking a tube down your throat, like an endoscopy, it may show some ulcers. It may show some erosion, but it doesn't tell you whether you have bacteria overgrowth. It doesn't often tell you if you have H. pylori. It doesn't really give you answers. It just tells you whether you've got different things going on with the lining. So, which can be useful. If you've got a precancerous condition, it's good to know. So, but people get stuck on these meds for long periods of time. So, for testing the stool culture, you look at the large intestine, small intestine. You're looking at, they have something called a breath test that tests for methane. There's specific types of bacteria that you can look at to see if it's high or low, again, on that GI test. You can add on the H. pylori to see if that is out of the range, if you have a potential for a bacterial infection on there. You can always, your doc will typically hit that endoscopy. So this is the stuff we do. That's usually the procedure that, your primary or your gastroenterologist will go to, And had a guy in today, he had the endoscopy and the colonoscopy on the same day, What a great day. So fungal infections. Think yeast. Think candida infections. So digestive issues, again, similar. Bloating, gas, diarrhea, constipation, abdominal pain are frequent symptoms. Fatigue, tiredness. Fatigue often due to malabsorption or the body's response to infection. So when you have yeast overgrowth in your gut, you're going to have sugar cravings because yeast is telling your brain, feed me, Seymour, and you will have more cravings than you normally would. So you start to cut out that yeast in your colon, you'll start to have fewer sugar cravings. So you don't want to feed it. So that's why you'll have strong cravings for sweet or starchy food, which can feed the yeast. So what happens in the gut affects the brain because we do have that connection there. So even little microbes can create something like that and can kind of rule what your brain thinks about. So, and we just think, oh, I've got a sweet tooth, Well, sometimes there's a reason for that. So when we look at fungal infections, you want to look at a symptom like brain fog. That's another one that'll commonly show up. You might see recurring yeast infections. So like vaginal yeast infections or oral thrush could be another one. You might notice skin or nail fungal infections. You might see anxiety, irritability, or different mood swings or mood changes associated with this. So on this culture test, again, we'll see down here Candida albicans. So potentially pathogenic at a +2. So we never want to see that in the gut. So now what we want to differentiate is an overgrowth versus an infection. So we have yeast in our gut. And again, in the right balance, not a problem. We have bacteria in our gut. In the right balance, no problem. If we have an overgrowth, then that can eventually lead to an infection. And depending on the type of bacteria or yeast, those can be opportunistic and they can create infection more likely than some other kinds. So prevents normal growth of microbiome. So yeah, if we have too much yeast, it's going to keep the amount of the beneficial bacteria lower than it should because it's overgrowing, so we'll have troubles with that. So some different types of Candida infections. Candida is the most common cause of yeast infections. You'll see bloating, gas, and diarrhea. There's Candida glabrata. That's another type that we can see. Less common, but is more resistant to antifungal treatments. We'll see something called Candida tropicalis, and that can cause a systemic infection. So a yeast infection all over the body. There's Candida, I'm not even sure what the name of that thing is. Parapsilosis, maybe. Known for causing infections in hospitalized patients, particularly those with intravenous catheters. So that might show up as another way of getting a Candida infection. So what are some of the ways that we can work against that? The Wellness Way carries something called CY complex, and it helps with some of these Rhodotorula. That's a tough one. That's a tough yeast to get rid of, and you'll typically find it in immunocompromised individuals. So cancer patients, patients with maybe HIV patients, but patients who have a depressed immune system. So this is one that can help with reestablishing and helping against that yeast overgrowth. So there's, again, other different fungal infections. These can cause invasive infections, more common in the immunocompromised, less commonly found in the GI tract, but can be detected in stool samples, which is how we test for that. Again, what are some of the causes for fungus infections? Decreased stomach acid, antibiotics, too much sugar, and immune system compromise. So are the most common. Parasites. So parasites can be anything from roundworms, tapeworms, flukes, protozoa. So any of those kind of things they test for all of those in the stool sample. How can you get that? Swimming in contaminated water. So, when we're in those lakes and streams and things like that, the rivers, lakes, poorly treated public water, they talk about the amount of goose poop that's in a lot of the ones around here and why they close some of that stuff down. It's because of this. So contaminated food, rotted food, produce washed in contaminated water. So again, so important to have the good stomach acid, poor hygiene, the fecal-oral transmission, close contact with other infected individuals or animals. So the people who are sleeping with animals in their bed at night, let them lick them in the face, things like that, you have more propensity to get some of these things. So I can't tell you how often when someone comes back with one of these on their stool test, okay, do you have animals? Do they sleep in your bed? Those are the two questions to ask. So that close contact can really bring that out. Cats, dogs, So parasites, stomach acid, can kill or inactivate many parasites before they reach the intestines. They're strong enough to destroy parasites and eggs. They denature the proteins in parasites. Some parasites have evolved mechanisms to survive the acidic environment. So they have different envelopes around to protect them. But that's why we have stomach acid. Okay? It's a great way. It's a first defense against parasites. So if you don't have enough stomach acid, chugging some apple cider vinegar would be a start if your stomach can handle that. If you can't, then you might have to work your way up to something like that. So if you have a lot of GI, like stomach issues, you may not be able to do apple cider vinegar. It might cause more heartburn. But for a lot of people, taking some of that before a meal starts the process of your stomach producing stomach acid.
Like how much before a meal?
Kind of depends. Some people need to mix it with water. I'll do 1 to 2 ounces.
Okay, so
That's what I do.
you don't need like an 8-ounce bottle.
No, oh no, not at all. No, it's a small amount to get that started. If you hate apple cider vinegar or can't stand the taste of it, it can come in capsule form too. So betaine, hydrochloride, or Digest-Well are a couple different supplements that we use for patients. We usually have them start it right before the meal, 5 to 10 minutes before a meal. So the Wellness Way approach looks at the 2 paradigms of health. So when your house is on fire, the person you want to call is the fireman. And they're going to put out the fire. Okay? If you want to rebuild your house, though, having a fireman come and spray down your house or use the axe to get in, they're not going to rebuild the house well. Okay? That's where more of a carpenter approach might be in order to rebuild the house. So think of this in terms of your body. Okay? If you have a heart attack, the medical approach is going to be the best one to save you from that heart attack. They're going to, get you to the ER. They'll pump you with the right stuff. Maybe there's surgery. Maybe there's not. They'll put you on medications to stabilize you and save your life. But if you're going to try and rebuild your body, their approach is you stay on this cholesterol med, blood pressure med for the rest of your life. Now, those have a lot of side effects too. So if you want to try a different approach to try and not be on those medications, that's where the Wellness Way comes in. Okay? We're not a fireman doc, so I don't want to have somebody have a heart attack and me do anything. I'm working with chiropractic adjustments. We're working with herbs and nutrition and things like that. It's a process, and it's not a microwave. It's a crock pot approach. It's a slow approach to rebuild the body. So we talk about the Swiss watch principle because your body is fearfully and wonderfully made, being every part of it interacts with another part. And so in the case of Mark, the guy with the skin issues, that's called the integumentary system. That's your skin. He was having a problem there. But it wasn't the skin that was the problem. It was actually the digestive system. So when you're having an issue, it's going to affect every part of your body. So when someone has a blood sugar issue, that's going to affect their liver, it's going to affect their immune system, it's going to affect their nervous system, it's going to affect their skeletal system. So when you're working with the body, the nervous system is the central piece because it communicates with the different organ systems. But all of these have a part to play with each other, and they've all got to be working properly for the body to work as a whole. So many people, say, oh, I'm pretty healthy except I'm diabetic. I'm pretty healthy, but I had cancer 5 years ago. I'm pretty healthy, but I had that heart attack. Those all play into the rest of the function of the body. So it's trying to work on the entire thing, not just take a medication because I had a cardiovascular event. That has a global effect on the body. And don't eat sugar. So what are some other things that can affect the body? So we talk about 3 T's: trauma, toxins, and thoughts. So trauma are life's bumps and bruises. So from childbirth to car accidents to sports injuries to slips and falls, to poor posture, all that stuff is trauma. Chiropractors are great at that. PTs are great at that. Toxins are what we put into our body, what we're drinking, what we're breathing, what we're putting on our skin. So we can have things like, mercury or amalgam fillings that can have metals in them. What we're breathing, what we're drinking, what we're calling health these days. The cosmetics that go on our skin that goes right in and is absorbed into the skin. If you can't eat your cosmetics, you probably shouldn't be putting them on your skin. So those have a lot of toxic stuff in them. A lot of us don't eat as well as we should. So, and if you listen to people like the National Dietetic Association and some of those other things, they'll recommend these as healthy for you. But if you look at the ingredients, we go here with high fructose corn syrup, high fructose corn syrup, glycerin, fructose, sugar, maltodextrin. So that's like 6 or 7 different forms of sugar in the first 3 or 4 lines. Now these are American Dietetic and Diabetic Association approved. And they would rather you eat this with cottonseed oil, here's high fructose corn syrup again, red dye number 40, blue number 1, hydrogenated soybean oil. I mean, this is junk. This is absolute junk. So it's a very synthetic food. And, just it's not going to serve you well. So here's some other ingredients to avoid. These things create inflammation. Inflammation where? Throughout the body, but particularly in the gut, because we're eating these things. So the trans fats, MSG, the high fructose corn syrup, the white sugars, white flours, the fake sugars, the highly processed vegetable oils, the seed oils, artificial flavors, soy proteins. So if you can try and stay away from those, it'll reduce some of your inflammation. So what's another thing that we do for gut health? We look at food allergies. So now this is a 3-year-old. There's 2 parts of our food allergy test. One test is IgE food allergies. Those are your anaphylactic, throat closing up, kind of severe reaction. So this 3-year-old had 7 out of 8 of those show up. So very high responses. And there's 6 antibodies, and peanut +6, eggs +6. So this kid came in, skin was on fire, couldn't sit still, scratching to the point of bleeding, just was in agony. So that's what she had on her first part of her test. Then she had 30 food allergies on the IgG. So these are the more delayed responses, the non-anaphylactic responses. So it may not close your throat up, but it can cause anything else, and up to 4 days. So trying to do a food journal and try and figure out what foods you eat could drive you crazy if it takes 4 to 7 days for these things to leave your system. And you can react for up to a week on these things. And notice, it's not McDonald's, it's not Burger King fries, it's regular real food. Beets, blackberries, cantaloupe, cauliflower, eggs, garlic, grapefruit. Nothing unhealthy there, but for her, it was creating an inflammatory response. Her body was reacting to everything. Her immune system was on fire. So, can these things change? The good news is yes. So, this was my wife's first food allergy test. She had 21 food allergies when we first tested her in 2021. And she was diligent with staying away from these things. We've worked on her stomach. We worked on her gut health. She avoided these foods as best she could for a year. We retested in 22, and she only had 5 on the second time. And my son had, I think, 26 on his first food allergy test, and he had, I think, I can't remember, 5 or 6 on his second one. So these can massively improve, but you've got to follow. You can't eat these things, okay? So
are you saying she could eat those things later?
no, yes, no, she has gone back to eating some of those things,
Okay.
and then we'll retest.
So what's perceived to be then the secret to why they disappeared? Because
Sometimes your body can now handle it because maybe she's always had stomach problems. So we worked on her stomach so that she could digest her proteins better. Mm-hmm. So this is a protein test. So again, stomach acid, making sure she's got enough stomach acid. So was a big one. If she had any other sort of problems, sometimes aloe vera is needed. Sometimes chamomile is needed for different inflammation pieces.
So in other words, issues in like your gut can manifest in an allergy.
Yes.
And if you can get your gut in order, then you can go back.
These can decrease. Yep. Yeah. This is also an immune test too. So, this kid who had so many, it's showing their immune system is reacting to everything. Everything is getting through the lining of the stomach into the blood. This is a blood test. None of these should be in her blood. None. You should not be finding foods in there, but your immune system has to figure out what are these things. Is it food? Is it a bacteria? Is it a yeast? So it has to go up and try and respond to all of these things floating around in the blood. So if you don't have a leaky gut or intestinal permeability that's allowing these things into the bloodstream, they'll stay where they're supposed to be, which is in the digestive system. That's a way.
So she stayed away from these things, but did she take anything also to help?
Sure.
So
Yeah. She took stuff to help with the stomach. She was probably taking some digestive enzymes, but we figured that out from doing the comprehensive GI test. So, because we could see she wasn't making enough enzymes, or she wasn't digesting her proteins well, or maybe she wasn't digesting her fats well. You can test for that and see what the person needs. So, and I've seen other people that, had 30 food allergies. The next time they come back, they had 30 food allergies or 35 food allergies because they either didn't follow it or something else is going on. So, but for some people, it's a massive way of helping them with reducing their inflammation. I had one lady who had right hip pain for a very long time. She had done chiropractic, PT, she'd done injections, massage. She went to her orthopedist to try and talk about a hip replacement, and he said, "You're too young, hip looks okay." She somehow had heard about a food allergy test. She did a food allergy test, cut out the 7 foods. Her hip pain stopped. So, that's one form of inflammation. So, it's not what I recommend for everybody, but in her case, I haven't adjusted her hip in probably 10 months now. So, I was doing it every 2 weeks. So for her, it was one of those foods or a combination of those foods. And it wasn't very many foods in her case. So when we have those infections, there are things that can be tested on your GI function test to see what herbs will inhibit the growth of the bacteria or the yeast or the parasites. So maybe it's golden seal that has the antibacterial, anti-inflammatory piece. Maybe it's Oregon grape that helps with H. pylori, E. coli, staphylococcus, helps with fungal and parasitic infections. Maybe it's oregano oil. Maybe it's wormwood. Maybe it's black walnut. So the thing is, instead of guessing, like some people say, "Oh, I'm going to do a parasite cleanse." Well, what does that mean? How do you even know if you have parasites? Some people just do these cleanses and they destroy their microbiome with some of these antifungal, antibacterial herbs or things like that, and their body doesn't need that. You can actually make things worse sometimes by doing some of these parasite cleanses, these antimicrobial products, or even sometimes taking a probiotic. You can actually throw off your microbiome more by sometimes taking a probiotic that isn't needed. So that's why we do some of the testing that we do. So if you have some interest, we go through all of this. We have what's called a new patient consult where we do our x-rays, we do our exam, our consult. We'll look over your previous labs from the last 2 years. It's $99 for it. And that's all I have. So thank you for coming. This is our motto of The Wellness Way is a network of health restoration clinics that think and act differently to solve the health challenges others can't. So, thank you for coming.